This episode is brought to you by our sponsor, the American Academy of Orthokeratology and Myopia Control, which is currently introducing its new base membership. What is base membership? Well, it's the AAOMC's new free introductory membership type, designed to help educate doctors on myopia control and orthokeratology. Whether you are brand new, an experienced fitter searching for pearls, or someone who's dabbled in the past and ready to step up their game, AAOMC base membership can help, and it's free. So what do you have to lose? Go to ortho-k academy.com, click on the practitioner button, and join us. Join the war against the myopia epidemic.
Welcome back to the Corrected View podcast, a podcast about ortho-k, about myopia control, and the people devoted to its role in specialty care. And I have with us Dr. Nick Despotidis, who is, you may remember him from his TEDx talk. He's written a couple of books, and he does an amazing workshop at Vision by Design called Supercharge Your Practice. And this is a continuing part of our monthly series where we have Dr. D on with us to answer any and all practice management questions that the listeners of the podcast had for us. Nick, welcome back to the podcast.
Thank you, Matt.
All right. And just a reminder, if you want to reach out to the podcast, our email address is thecorrectedview@gmail.com. The opinions that we're stating here, they're the opinions of Dr. D and myself. And if you have something to add or something different in your opinion that's contrary to what we say or agrees with what we say, by all means, let us know. Reach out. We'd love to hear from you. So, Dr. D, the first question that we have here, I absolutely love that you brought this question to me for this episode, because I was just talking about this the other day with a friend of mine from the patient perspective. So I'm going to go ahead and read the question, and then we'll dive right into it. So the question reads, when I attended your last Supercharge, one of my goals was to hire an associate and be only open Monday through Fridays. I'm happy to report that we are now only open Monday through Fridays, and we just had one of our most profitable Septembers in 10 years. I'm writing because in the 3 years I've been practicing myopia management, I've not encountered anyone who asked for a discount. I've had people who were disappointed, but then eventually paid the fees. I had a returning patient who brought in her adult 20-year-old daughter, and though there is no real change in her vision, we still charge the same fee for previous wears. The parent is asking for a discount since she has referred so many people to us. I'm trying to think of a professional way to talk to her and was wondering what your approach is, as I remember you mentioned that you have encountered this many times. So basically the idea is you have a patient who says, hey, I've sent you a lot of referrals. Can I get a discount because of the amount of business that I've sent your way? So Dr. D, how would we respond to that?
Yeah, the way I responded to this optometrist is, first I congratulated him, because it's one thing to attend Vision by Design workshop. It's a whole different story to take action on it. I also said he's on the right track, because if he wasn't being asked for discounts, he was not busy enough. Everybody smiling out there who actually does ortho-k is we get asked for discounts daily. It depends how busy you are. So he's on the right track, or she's on the right track. Number two, my philosophy has been, doing this for so long, is I did away with all discounts. And it was something that's very scary to do, because we used to offer sibling discounts. We used to offer prepayment discounts. We would discount our services, and we realized that this was a race we couldn't win. Because if you're competing on price, as we've discussed before, Matt, at the last episode, or you're trying to be the best discounted practice, you lose. In addition, I've tried, this is asked of me often, do you offer an incentive for patients to refer to you? This is a very commonly asked question amongst practitioners. And the answer is no. The reason we don't is a multitude. You want patients ultimately to refer to us because of the care we provide, because that's where our competitors cannot compete with us. I know it sounds corny, but it's so true. Because if you offer one patient a discount because they refer to you, what you'll find, if you're really good at your craft, multiple patients will refer to you. That's the ultimate goal. It's not just I go to Dr. D, I go to Dr. Matt, I go to Dr. So-and-so. It's like, no, don't waste your time. Go to Dr. D. So that is hard to achieve, and we're going to talk about some of the things later on of what I do to achieve that loyalty. But number two is that once you offer this patient who is requesting a discount, the discount, she or he is going to tell their friends, hey, ask for a discount. You may have to harp on it, but they will give it to you because I got one. And then you've lost, because now it's all about the discount. The way I respond to this parent, and I get it all the time, is I know you refer to me. Number one, you have to acknowledge it. And number two, I appreciate it. Those are the two things. I know you refer to me, and I appreciate it. And I follow up with the third thing. I never take the regard and trust you show in my care by referring your friends and family. I never take it for granted. But I want you to understand, I give the same level of care to your daughter, to your friends, as I do to everyone. And the reason I don't give a discount is because the price you pay is the same price everybody else pays, which is correlated to how much work it is. And I really do care about your friends and family, and I hope that's why you refer them to me. So although I would love to give you a discount, I cannot, because my care is predicated on the amount of time I spend with each friends and family. At this point, the parent always smiles and says, I know, Dr. D, I know you care. I know you do this. I just had to ask. And I do know a lot of my friends refer to you. So we take a situation where, listen, I had to ask because it's just in my DNA to ask. And number two is, I understand. I really do understand your care. So we have acknowledged they refer to you, and we also acknowledge you never take it for granted, but you stand firm on that. Listen, I hope you refer to me because you know I truly care about your daughter, and I truly care about every patient comes in here. No one can deny that. The opposite of this is, you're right, let me just give you a 10% discount, whatever you decide. Now you've set the precedence where if they ask for it, you're going to give it. And then your competitor will give 15% or whatever they give. It doesn't matter. You can't win that race. So I see you shaking your head because you've been in the field a long time. And this is coming from a place where I've offered discounts. And this is something very important for everybody to know. I measure everything. I measure everything. And I noticed this when I gave a 10% discount and I wanted to be busier at one time, I gave 15%. Figuring, okay, if they pay a time of service and they've referred patients to me, I'm giving 15%. My conversion rate, the amount of patients who enrolled in my program, did not go up. But my profitability precipitously went down. Because you have to be very, very careful with discounts. Any true MBA will tell you, when you give any percentage of discount, you have to increase the volume of patients you enroll in your program much more to make up for the loss of profitability.
Yeah.
So that's what I'm saying. And I'd also say you may lose patients, and that's okay. The word gets out is that Dr. D may be a good doctor, but they don't give discounts there. And that has saved my staff and myself so much aggravation and effort because the word is already out there. No, they don't give discounts. Like Apple. I try. Every time I damn upgrade my Apple phone, I mention it all the time. My Apple Watch fell after 3 months, and I had to buy a new one because I didn't have the warranty, and it cracked. It doesn't matter. I had to buy a new watch because I know when you come in after me, the same rules apply. But if I find out that Matt Herzberg got a better deal than me, I don't buy an Apple product. You know, it's the same philosophy here.
Yeah, you risk turning off your patients And that's why I was really excited by this question, because like I said, I was just having a conversation about this the other day. So I have this inside joke with a couple of friends of mine that says, we started with gift cards and now you're offering me a car. And the reason why we have this joke, yeah, the reason why we have this joke is because I had a dentist that I went to for years, back in 2004, 2005 is when I started going to this dentist. I live in the city of Chicago. I'm from the suburbs. This dentist is out in the suburbs. It's a 45-minute plus trip with no traffic to get there. Okay. And I went to that dentist for years, and I had braces as a kid. I've had a lot of negative dentist experiences in the past. So when I find a dentist that takes good care of me, and I like the staff and I feel like I'm in good hands, that's really important to me because of my really bad experiences in the past. And so eventually that practice got sold. And when I first started going to that practice it was an excuse to see my parents. My parents are out in the suburbs. Back then is when we were first forming the academy. So I'd use it as an excuse to meet with Kerry because he was the first president of the academy, and we'd do work and have meetings. But then over the years, it was like I was seeing them less and less during those trips. So eventually that practice gets sold, and the new owner decides to start implementing the gift card, the Starbucks gift card, for a review on, Google or Facebook or whatever the case may be. And I get this a lot from doctors that I talk to about this strategy. And I did this in exchange for a $5 Starbucks gift card. I left them a review, and I left them the best review that I could, but it made me feel really cheap. Not for lack of a better term, I don't want to say it left a bad taste in my mouth because we're talking about the dentist, but it did really make me feel like a gimmick, Yeah. And I don't want my healthcare to feel like a gimmick. And
right.
And this got to a point where eventually they were sending me offers in my email to enter into contests by leaving reviews or whatever. They were referring people, and that could eventually get you a car. Like, no joke. Wow. They were offering me a car as a part of a contest. And that I was like, that's what this has come to. Like, we started with gift cards and now we're at a car. And the point I'm trying to make is, if the gift card worked, then we wouldn't have to be at the part where they're offering me a car. And
right.
And I think that speaks a lot to what you're saying, is like, if you have to offer a discount to get a review from your patients, then what does that ultimately mean about your standard
right.
of care?
Right. And I think you hit a very important point, because physicians, we're not marketers, but sometimes we enjoy marketing. Mm-hmm. And people have always asked me, do you give a spiff to staff members for enrolling people? Right. Do you give patients a Starbucks gift card for referring? A lot of us give solutions for reviews, T-shirts for reviews, mm-hmm. things like that. And really, as consumers, it does make us feel cheap, because if I refer you, Matt, to a dentist, and you find out I got something for that referral, mm-hmm. It's a double negative. It's like, is right. Nick really my friend? And number two is, I'm wondering, is this dentist really good? Or is it just because he's giving out or she's giving out gift cards? It's mm-hmm. a double negative. The other thing that is evident, in the beginning, we all looked at Google reviews, Amazon reviews, but we've become educated consumers, saying, mm-hmm. it's suspicious when there's thousands of reviews. And in the past, I would say, hey, they must be really good. Then what I do, I sort the reviews by negative first, mm-hmm. and then you get the real story. Right. So you're right. I mean, it's really a difference in philosophy. One is not bad, but you can't play both sides of the court, if you will. Right. If you're going to go on quality care, you'll get some sincere reviews, but maybe not hundreds. But the other thing is, when you read those reviews, they were unsolicited. Mm-hmm. Exactly. And the bottom line is this dentist may or may not be, accepting a boatload of insurances, but at the end of the day, you just want to be busy. And I'm not sure how happy they are.
Right. And there's actually, I'm trying to think of the name for it. There's a name for the phenomenon of not trusting reviews that our current society is kind of dealing with right now, because reviews can be manufactured. Obviously, they can I tried to give the most sincere review I could in exchange for a $5 Starbucks gift card, which seems ridiculous at the moment when I'm saying it, but I don't do that anymore because it's not worth my time, and that's not how I want to represent my experience there. I'm not ordering a pizza from Domino's, you know what I mean?
And take it one step further. Look what they lost. A patient who traveled an hour, valuable hour, to get there and back, that's 2 hours, give or take.
Sitting in traffic as well.
If I said you need root canal, I don't know, XYZ, you probably would do it if you trusted me.
Exactly.
Instead, you're just getting someone now who really, you've lost a valuable patient. The cost of that is tremendous. And now you have to sift through a lot of other patients to find another Matt Herzberg who's a quality patient. We call it quality patient, quality referral.
Exactly.
So, yeah, that's really interesting. So this OD is on the right track. If they're not getting asked for discounts, they're not busy enough, and they're smart enough, astute enough to know this is not going to be the conversation to have, but it's one is very worthwhile having.
For sure. I mean, at the very least, is a chance to reaffirm that faith and connection with the patient. This is why I don't offer a discount.
Right.
And there's God, what is it? I was just reading about this the other day, actually. There's something that we all do almost subconsciously in the way that we interact with each other, where it's not malicious like 99% of the time. The way we talk with each other, the things that we allow to happen in conversation in our lives, send these subtle signals to other people that this is what they can get away with, or this is how we can treat each other. And like I said, it's not meant to be malicious, but like you need to send a signal to people that these things are this way for a reason, and people will respect that. And as you said, if they don't, maybe that's not the patient that you want to have.
Right. And the bottom line is, if you think about what we do in ortho-k, sometimes we oversimplify it. We're reshaping children's corneas. I can't think of something more valuable than your child's eyesight. And if you're referring to me because I'm giving a better discount or a less price, then you listen to what I said. My staff is happier, I'm happier, and the patient's happy. Because the bottom line is, I'm not going to any doctor, whether they give me 10% or 50% off, unless they take really good care of my child's eyes. Bottom line. So that was a great question.
Yeah, and I would also like to point out that in this person's email, there's mentioning their most profitable September in 10 years. And that's amazing, especially with the pandemic and everything and the downturned economy. And it just goes to show you how valuable specialty care, ortho-k myopia management can be. And that's kind of a drum that we've been beating here, is that, this is the time for you to reinvent yourself and bring specialty care into your practice.
And Matt, our very first podcast was a discussion where the reason I became a specialist in this area was during the anthrax in 2001. It's same thing. It was catastrophic to my primary care practice, but I noticed there was a resilience to specialty care like orthokeratology or myopia management. And we're seeing this again. It is amazing when you think about where most of us are working harder than ever just to gain some back pay or whatever you want to call it from the time we were closed. This OD is saying it was the best September ever. Good for him or her.
Right. Yeah, that's amazing. I love reading that.
Yeah.
All right, so let's go to our second question for this episode. And this says, any videos or tips that would encourage kids to want to wear ortho-k? And they said the parents are willing and paid for the lenses, but the patient will not have anything to do with the contact lenses after trying it once. So Dr. D, how do you respond to this question?
I have a lot of experience with this, and if you get good at this, you will be much more successful than you already are. You have to realize the parent's motivation for enrolling in a myopia management program, whatever you refer to it as, is very different than the child. If I was a 10-year-old, 12-year-old, 8-year-old, the last thing I want to do is put any contact lens in my eye. And if I do feel a gas permeable lens in my eye, then I'm definitely not going to do it. I'm intelligent. It's a lot of work, a lot of discomfort. I'm very happy with my glasses. So what we've learned to do is be very proactive, knowing the child is not going to want this lens in their eye. That's the assumption we make, no matter how much the parents want it. So we do a number of things. The last podcast we talked about, I now, during the quarantine and during this pandemic, I meet with parents beforehand. And I tell them why. I have a video chat with them, either with Google Meet or Zoom, and I say, I want a more detailed history. I want your child to meet me when I'm not wearing this mask and wearing gloves, and all my technicians are wearing gloves. We're taking your temperature, where you have to call my office still. Look at the different feeling we have right now as opposed to when I take off my mask and I can meet the child and explain to the child what's going to happen during the consultation. So I'm going to assume that the child will not like that gas permeable lens when they come in for the consult. So step one is I get the child to meet me virtually with the parent, and I explain to him the purpose of the exam, what exactly is going to happen. And number three, I think this is important. I tell the child, you're not going to get anything after the consult. The purpose of the consult is not to get anything. The purpose of the consultation is to tell your parents what options do they have to slow down your myopia if that's the case. Could be eye drops, it could be contacts, it could be glasses, it could be a number of things. Once I get their trust, I also tell them tomorrow when you come in or whenever you come in for your consult, you're going to get a snack. And the kid, I think I've told you, say, I don't want snacks. I know exactly where this is going. You're trying to bribe me. So I don't know if you're going to videotape this, Matt, but I'm in my exam room now. I have 7 exam rooms, and they all have prize boxes in it. So I want to just show it to you. I don't know if you can see it. Tell me if you can. I'm going to try here. So this is how my typical prize box. So notice what you have here. You have a lot of colorful stuff. Each of these bags are stapled shut. And I explained to the parent, the reason they're stapled shut is no other child has touched these snacks. Because of COVID, we're much more careful. So they have a surprise in them. Each of them has 3 different snacks in them, and the child gets to select them before we put on the lenses. Okay, so I don't bribe them. I said, listen, you're going to get 2 of those bags today. Two bags. And the child doesn't want them yet. You're going to get 1 before we put in the lenses, and we're going to give you 1 afterwards. So 6 snacks. So right now, I've deflected from I'm scared to death of anything going near my eye. If I'm 10 years old to, well, how long am I going to have the lens? And I explain to him 5 minutes, that's it. And I ask him, is 5 minutes a long time or a short time? And oftentimes the child says, especially if they're smart, they say, well, it depends. And they're right. And we talk about that. So now I've developed a rapport with the parent, with the child. They know I'm not out to hurt them. They know I'm not going to shove a lens in their eye. I explained to them the technician is going to put it in after they get their permission. And then we use proparacaine when we do a trial fitting. And because I've been doing this for so long, I basically make sure I do it quickly. I tell them their eyes are going to glow in the dark. I give them a mirror. They hold the mirror. So we go through this song and dance. And even with all that, the child is not motivated to do it often enough. It's 50-50. So they get 6 snacks that are in a surprise bag that they can't open until they leave. Because what we realize is they don't want to eat in the office. They get hungry the minute the exam is over with or the consult is over with. So to answer her question is, number 1, you make sure your office is child friendly. It's like an orthodontic office. We really are. So when you go to orthodontics, the child, there's a reward system to make them feel very happy about going there. And then if they can wear an ortho-k lens, we've instituted this a year ago and it works so well. is we say, listen, if your mom agrees to enrolling in our program, it's going to be a rough 2 weeks. You're going to have to learn to put it in by yourself, take it out 2 weeks. So knowing that, we're going to send your mom a link to Amazon.com. Do you know what Amazon.com is? And the child just smiles. So,
Mm-hmm.
of course. And you can pick out any gift there for $30. And we will have that gift all ready for you when you come in for your class. We don't call it an INR, we call it a class.
Mm-hmm.
And you're going to work one-on-one with a teacher, not a technician, a teacher. And she is going to show you how to put it in and take it out. And in order for you to pass your class, you have to do it 3 times. Once you do it 3 times, then you get your Amazon gift. That's all waiting for you. So where do we put the gift? Right in front of the shield, because these poor kids are learning in front of a shield now. The tech is wearing a mask. They're wearing a mask. You know, it really is a hostile environment. And right now we have 100% INR success rates, where it used to be 80%. So for our practice, 20% is a huge deal. And there's a lot more going on. So there's snacks during the consult, there's snacks during the INR class, and there is this carrot and stick, right? The carrot is you get snacks, you get an Amazon gift card, you just have to put this thing 3 times, and the stick is your parents will be very disappointed if you can't do this. So we give them homework beforehand, but for this particular question, I think the optometrist has to think like an orthodontic, like a 10-year-old. There's no video that I'm going to watch as a 10-year-old that's going to convince me to put an ortho-k lens in my eye every night. It's a lot of work. So that's how we've done it. It works extremely well. There's a lot of systems behind the scenes, but there's a lot of excitement. So now I'm looking forward to this $30 gift that I've ordered that I haven't seen, that's going to show up at this optometrist's office, and I just have to put this lens in. So there's a lot of good there. There's just a lot of good, a lot of fun. It has worked amazingly well.
Yeah, that's amazing. I'm glad you showed us the drawer with the treats in there in the packages, because I love the color of the packages. I love how it's organized. I love that they're not going to eat it until they leave. And as you're describing this whole thing, it reminds me of, in the AAOMC, we get questions from people about if we have kid-specific content, like videos and whatnot. And the problem there is that, you have to realize that, like, major entertainment companies spend millions of dollars to come up with, videos, books, toys, whatever, in order to get kids' attention and get them focused in whatever that entertainment or product is. And when you think about how you're just not going to be able to reproduce something without that scale, there is no silver bullet as far as a video or a brochure for kids or whatever the case may be.
You're 100% right. Paragon spent a lot of money investing in their INR video, their insertion removal. I don't know if you've seen it. It's caricature cartoons. And if this is a big company now, Cooper Vision.
Right.
And it's so well done, but they keep telling me how much they invested to produce it. And still, as a child, it's fun, it's nice, but that's not going to encourage me to do it. It's just maybe reinforces. Your practice has to be kid friendly. And just keeping that drawer as good looking as it has, I was just so happy when I opened it. It looked as good as it did, because we have systems to fill it up. And it just so happens we're doing this in the morning. But if I film this at 6 o'clock tonight, it would look half empty and ravaged through. But it's got to get filled up every morning. The techs was showing me they have a system to push out the snacks to the front because to make sure they're fresh, no expired snacks. There's so many systems that need to be developed, but we are a pediatric practice. I enjoy it. And this optometrist has learned a big lesson now. There is no brochure, no video, nothing you could say to the kid to make them want to put a hard lens in their eye. But there are a lot of things that you can leverage. And one of them is toys and gifts and surprises. We staple them shut. And they don't know if they're going to like the prizes in there, but it's a surprise. And all I have to do is let this person put the lens in my eye, and then I get it and I go home. And if they're siblings, and this is a good practice management, if they bring a sibling, and recently we haven't had siblings because of COVID, but oftentimes I encourage siblings because they're going to become myopic sooner or later. So I say to them, is this your brother? And they say, yes. I said, they get 2 snacks too. And they don't have to do anything. Wow. They just watch you do the work. And everyone's like, oh, darn. But it's fun now. And now the sibling's engaged. And every time the sibling comes for every checkup, Matt, every time a patient comes here, every checkup, we sometimes, like this afternoon, Wednesday, Thursday, we'll see 24 ortho-k checks. Every checkup gets a bag, and their sibling gets a bag, whether they're our patient or not. So it is a production here. But it's fun. It is fun.
That is so smart.
Good word of mouth.
That is so smart because, like you said, the way that the myopia epidemic is hitting us, it's like so many kids are going to be myopic. I mean, you wrote a book about it. My Kids Are Nearsighted Too, I believe is the title. It was a long time ago that I read it, but yeah, that book, details your experience as an optometrist watching your own kids progress in myopia. And I highly recommend it to any optometrist who's interested in myopia management. It's really interesting read. We've had numerous. Dwight Barnes has a practice focused on kids. Nate Benia-Warford has an amazing practice focused on kids. He has a little Lego figurine system where the kids and in that podcast, go back and check that one out, folks, if you haven't listened to it. But he talks about how he has a Lego figurines in his practice. And so if that kid has a Lego figurine, they can bring it in and trade out parts and get really engaged. And
you have to run a practice like you want it, but just realize the kids are not motivated to put the lens in. And if you, now just how we started here, do you give a discount? Listen, I go to Nate's office. It's fun, right? I've never been there, but my kids love Legos. And just think the child is 8 or 9 years old, oftentimes at 2, 4, 6 diopters myopic. This is a very intense, cerebral child most often. They're thinking through this whole process. Do I really want to get involved with contacts? Now you're going to an office that has Legos, that has snacks. You've really deflected the fear into something that's very pleasurable. And now contrast that with Mr. Herzberg. If you refer a friend, I will give you a $25 discount for every friend you refer. To your kids just want to come there. Your kids are happy there. Every time is an event. Which one feels better? It feels better, definitely, our way of making it a fun, enjoyable experience for your child. Your children have fun. You're happy.
Yeah, it's not just the quality of care that you're going to give them. It's that experience and the energy that you're putting into that patient, and that's going to mean a lot to that patient. And pre-pandemic, these parents are, they're on the soccer field, the game's going on, and they're saying, you won't believe the optometrist I just saw the other day. Is incredible, and like they'll talk about it.
Yeah. And really, the quality of care, I think that's a good point also. Being involved with ortho-k and your academy as an instructor, lecturer, I've realized everyone in that audience, everyone really produces the best quality care they can provide, no matter what they charge. It's almost like they all care a very high degree. The question is, are you going to be happy now? Are you going to be rewarded for that care? And I think that's why these podcasts are so important, because you want to feel, I feel equally happy every time I give out that gift. And of course, my fees reflect all this, having staff to program the procurement of snacks and games and bags and Amazon cards, because if that Amazon gift is not here when the insertion removal class is on, it's over. The systems fall apart. So all that energy, but you're right, the common denominator is I'm doing the best clinical care I can humanly provide, and everything else is what builds your practice and your level of happiness. really is.
Yeah. I couldn't agree more, and that's definitely why we're doing these podcasts, to show people, the men and women who work in this exciting, exciting specialty, so that they can relate their personal experiences. So
You see how much care. I mean, these threads in the Academy blogs and Gmails and this new app that I have, they're passionate. There's no other word. Now you have to realize the cornea is not my customer or my patient, right? The child behind the corneas. So if I want to be successful, I not only have to get my clinical house in order, I have to get this whole office in order to cater to children who are becoming increasingly more nearsighted. Once you get that kind of that click, you'll be fine.
Well, yeah, definitely excellently put. And I really appreciate you coming on the podcast. And we had a great couple of questions. And there's so many things that are popping into my head right now, but I know we gotta move on. And so we'll talk about those questions in the future. And if any listeners out there have a question for Dr. D, the email address is thecorrectedview@gmail.com. We also have a Facebook group. And as Dr. D mentioned, we're using an app called Discord to have a private server for AAOMC members. You can text, chat in real time. You just use it off of your phone or computer, and that's a benefit for our members. So go to ortho-k-academy.com and click on that practitioner button and look into becoming a member, because you have this kind of expertise at your fingertips at all times. There's so many doctors just like Dr. D who are super passionate and will definitely answer questions, and you never know what kind of discussions are going to happen on there. It may be about any particular aspect of practice and myopia control, and it's definitely an experience. So Dr. D, thank you very much.
Thank you. Thanks,
and
Matt.
we'll have you on for the next one.
Thank you.